Hi, I'm Dr. Regina Joseph, Cosmetic Gynecologist in HSR Layout, practicing at Splendore Aesthetic Clinic, Bangalore. As we know, the woman during the childbirth or due to the process of childbirth would go through a lot of changes in the body. It could be a lot of developmental changes, and there will be a lot of relaxation of the vaginal wall. There could be sagging of the breast. There will be a lot of fat deposition around the abdomen and at the low angles. So overall, there would be a lot of fat deposition and skin relaxation. Because of this, there would be a lot of fat deposition for which a woman would seek or require a cosmetic gynecologist assistant, because most of them would lose the drive for the sex. They may not be enjoying the pleasure of sex. That's because of lax vagina. They may not be feeling good about it. So in cosmetic gynecologist, what we do, there are several kind of treatments where we do carbon dioxide laser rejuvenation of the vagina. This laser causes or induces or more heat is generated, which in turn causes more collagen formation and neovascularization with increased gland secretion, which also helps in lubrication and thickening of the vaginal wall, which in turn results in feeling good about the sexual pleasure. So what are the contraindication? Any woman who having local infection or who having a pacemaker could be a contraindicated person, and the female would like to wish to get it done, have got no downtime. This is all done on OPD procedure, and it may be required 3 sessions maximum for a woman at interval of 4 weeks. Given an overall improvement would be good for the patient. So I would still recommend vaginal rejuvenation through carbon dioxide laser, which is supposed to be an awesome result in a woman who's looking forward for retrieval of the sexual pleasure in a woman. Thank you.